You ready to record?
Mm-hmm.
Let me get a pen. Okay. Here's how it works, and I'll go back. First of all, most of these brains are labeled on one side with Roman numerals, and they're bare on the other side with no Roman numerals. Guess what side I'm going to use to quiz you on? The bare side, right? Exactly. So let me just show you how it runs. It runs 1, 2, 3, like that. 4, 5, 6 is back in the center. So let me do that again. I'm moving right down. 1, 2, 3. 4 is that little one way in there. Way in there is 4.
Okay.
Way in there. 4, 5, 6 is in the center. And by the way, 12 is in the center. So 6 and 12 are right in the center. So that's 6. 7, 8, 9. 7, 8, 9. I'm missing 10. 7, 8. Let me see. 7, 8, 9. Oh, yeah. 7, 8, 9, 10, 11, and back to the center is 12. 10's hard to see. If you come over here, on the label side, it'll say 7, 8, 9, and 10's right here, and here's 11. 11's called the spinal accessory or the accessory. It's near your spine. It's called the spinal accessory or just accessory. It's there. And then 12's back to the center. So they really come right down through, then to the center, and then back down through and then to the center. So 1, 2, 3, 4, 5, 6 is in the center. 7, 8, 9, 10, 11, and back to the center, 12. Now, I'll come back and do that again. But you have to know more than just that. So let me show you how to memorize these things. First of all, you have to know your Roman numerals. So make sure you remember your Roman numerals. Six, 7, 8, 9, 10, 11, 12. There's a saying to help you memorize this. Our old oxidized trusty truck acts funny, very good vehicle anyhow. So the saying is, our old oxidized trusty truck acts funny, very good vehicle anyhow. If you don't like that, there's a bunch of dirty sayings online. Look them up. It goes like this. O, to touch and feel, and I'll just stop there. Go ahead. It's a dirty saying. You might remember it better. I'm not going to go after feel. It gets dirty after O, to touch and feel. All right? Very good vehicle anyhow.
Go ahead, Sam.
Now, what does that mean? That means olfactory, optic, oculomotor, trochlear, trigeminal, huge one. Trigeminal's easy. Abducens, facial, vestibulocochlear, glossopharyngeal, vagus. This is called accessory or spinal accessory. So this might, if you look up a saying online, it might start with S. Like there's a saying, Onolipid towering tops of Finn and German viewed some hops. Well, how is it viewed some hops? Spinal accessory starts with S. And then lastly is hypoglossal. Lots of sayings out there, by the way. Now another saying. You need to know the functions that are on the sheet. Some pretty specific functions I'll talk about in a second. But just to get started with functions, you can say this. Some say marry money, but my brother says bad business marrying money. Some say marry money, but my brother says bad business marrying money. If it starts with S, it's sensory. If it starts with M, it's motor. And if it starts with B, it's both. Now that gets you going. There's only 3 purely sensory ones. 1, 2, and 8. 1, 2, and 8 are purely sensory. Smell, vision, hearing, and balance. Smell, vision, hearing, and balance. All right? Purely sensory. The rest are either motor or both. All right? Three, 7, 9, and 10. Just a second. I'm going to make sure that's what it says on here. 3, 7, 9, and 10 are parasympathetic. Have parasympathetic functions. 3, 7, 9, and 10 have parasympathetic functions. That's a motor system that's rest and digest. That's what that means. For example, what does the ocular motor nerve do for you? It goes to your ciliary muscle. It goes to your ciliary muscle and it relaxes your lens. So when you're sympathetically, your lens sees far away so you can see the saber-toothed tiger a long ways away. But parasympathetically, you break your lens so you only see close up. You don't have to see that potato chip a long ways away. It's right there in front of your face. So rest and digest, your ocular motor controls your lens so you don't have to see far away. Parasympathetic. Parasympathetically, your glossopharyngeal and vagus will, glossopharyngeal will hit one of your salivary glands. They both deal with your heart rate. They detect blood pressure and adjust your heart rate accordingly. Your facial nerve goes to your salivary glands as well. All right, now look on your list and let me tell you how I think of these functions. Olfaction is easy, it's smell. Olfaction is easy, smell. Optics, easy, it's vision. Now, oculomotor goes to 4 of the 6 eye muscles. There's 6 eye muscles. There's 4 rectus muscles, superior and inferior rectus, lateral rectus, and medial rectus. And then there's 2 oblique muscles, a superior and inferior oblique. The ocular motor does 4 of those 6 eye muscles. And here's how I remember them. It doesn't do the superior oblique, abducens does, or trochlear does. Trochlear does the superior oblique. And it doesn't do the lateral rectus, the abducens does. So it does the rest of the 6. It does the medial rectus. It does the superior rectus. It does the inferior rectus. And it does the inferior oblique. So your ocular motor has parasympathetic activity. It does 4 of the 6 eye muscles. All right? Then, what does the trochlear do? It does your superior oblique eye muscle. What does the abducens do? It does the lateral rectus muscle. Now your trigeminal is a huge, huge nerve, and it looks like this. By the way, it does a bunch of things. It looks like this. So my knuckles are back here near my trigeminal body, and it has 3 main branches. One going to the eye, one going to the upper lip, one going to the lower lip. 3 branches. This is why you get cold sores on your upper lip or lower lip, because your herpes virus hangs out in your trigeminal nerve. And sometimes it goes to your upper lip, it causes a cold sore here. And sometimes it goes to your lower lip and causes a cold sore here. Sometimes it goes to your eye and causes herpetic keratitis. Not a good thing. This is the ophthalmic branch, this is the maxillary branch, this is the mandibular branch. They control muscles and they do sensory input from those regions. That's what the trigeminal nerve does. It's a huge, huge nerve right here. That's your trigeminal nerve right in there, a great big nerve right there. Oh, by the way, there's numbered nerves inside the skull too. Not just on the brain where I showed you, also inside the skull, and they're numbered for you. You can see them. So that's the trigeminal right there. Let's keep going. Abducens, here's how I remember lateral rectus. It abducts the eye. Pulls your eye to the side. So the abducens abducts. Abducens abducts. Lateral rectus. Obviously, when you're abducting your left eye, your right eye is going immediately, but, I mean, that's what the abducens are. Turn your eye like that. Facial nerve. This is both as well. Like the trigeminal, this has sensory and motor output. It goes to 5 areas. It goes like this. Cervical, mandibular, buccal, maxillary, something. Go like this. You put your hand like this, and it has these 5 regions that the facial nerve hits. And the regions all have names. And I actually did it in lecture for you. I showed you these colored areas in the thing. But that's both. It does some of the muscles, and it has sensory input from parts of the face as well. Facial expression is a big thing for the facial muscle, for the facial nerve. Vestibulocochlear is purely sensory. It's hearing and balance. Glossopharyngeal and vagus, we already did. Glossopharyngeal and vagus are parasympathetic. They affect heart rate. What else? I don't know. What else did I tell you?
Taste and swallowing.
Yeah, look at that. What does pharynx mean to you? The throat, swallowing. There you go. Yep, good. The vagus means wandering. The vagus leaves the cranium and goes throughout the body. You guys learned the vagus nerve on the esophagus before, remember? Mm-hmm. So vagus means wandering. This wanders outside the cranium. The accessory goes to the sternocleidomastoid muscle. Did I tell you anything else? Trapezius. So this muscle right here, the sternocleidomastoid and the trapezius, that's where the accessory nerve goes. In the hypoglossal nerve, glossal means tongue, it goes to the tongue. Hypoglossal goes to the tongue. So really these are kind of easy if you just think about them. The facial and trigeminal are huge nerves. They have lots of branches going all over the head. Any questions about that? Any questions about the sayings? Let me see if anything else to tell you. No, let's look at that. That's about it. By the way, under vagus, it has a lot more functions than what I listed there. See how I said pharynx and then visceral organs? That means it goes down to the heart. It even goes further. It goes down into the abdominal cavity too. Okay, so your job, and let me show you a couple other things. Keep that running. Here's another model I like to use. Here's another model I like to use because you can see the trigeminal nerve right here. Big trigeminal nerve right there. You can see the vestibulocochlear and the facial nerve right there and right there, side by side. They both use the internal acoustic meatus right there and there. You can see the olfactory nerve, nice and easy. You can see the oculomotor nerve, easy right there. That's the oculomotor nerve. You can actually see the optic nerve. Now, I got to tell you, yeah, I don't mind it. You can see the facial nerve right here. This is a branch of the facial nerve right over my eardrum. And it's called the chordae tympani. Have you ever heard the condition where an ear problem makes you have a funny taste? You ever heard that? You've heard that before.
I remember when I was a kid I had that happen once. I don't know. I never heard that.
You've heard that. Well, here's what happens. Look on facial nerve. It should say taste, does it? Does it not? Yeah. Facial nerve hits your taste buds. A branch of the facial nerve goes right over my eardrum. So when you have an ear problem, it tricks your brain into thinking you have a taste problem. You can actually feel like you taste a weird taste in your mouth and it's really an ear problem. And why is that? A branch of the facial nerve goes right over my eardrum right there. See, when you hear these things in medicine, and there's usually an anatomical reason why this is true. Okay, in here and there. This is probably why you get, is that the Terrigo powder? Yeah, it is. This is probably why you get headaches when you eat ice cream. No, that's not it. That's not the one. There's another ganglia in there, which is probably why you get headaches when you eat ice cream too fast. It's not shown in here. That's not the one. All right, so there's a bunch of nerves in here you can study.
What about people that like seizures and
Yeah, I was thinking
does
about
that have
it.
anything? Any of those at all?
Certainly probably does, but seizures are caused by desynchronizing your right and left hemisphere usually. So I'm sure somehow it's hitting your olfactory, somehow it's affecting your olfactory. Oh,
Like, oh, I'm smelling this. I know I'm gonna have a seizure.
the olfactory nerve is one of the few sensory neurons that doesn't go through the thalamus. Okay, so it does not go through the thalamus. Does that mean anything for this story? I'm just kind of thinking out loud right now. Goes to the rhinencephalus, temporal lobe, frontal lobe, maybe even a little bit of the parietal lobe, and probably a little part of the insula. I know the insula is mostly gustation, but it's a little bit of olfaction as well. I can't think of a reason why right now, but yeah, I'm sure there's an anatomical reason why. So we got this model. You got these brains with all the cranial nerves labeled right on them, and they're labeled on one side and bare on the other side, so you can study yourself. You can check yourself. Some of them are labeled inside of here and on the brain. These are good models. Oh, there's a cranial nerve 13 in here. Don't worry about it. It's really part of number 7. When you hit XIII, cranial nerve 13, just say to yourself, oh, Kiggins told me that was part of number 7. For the most part, we'll say it's part of number 7. It's not really a cranial nerve 13. All right? Any questions about what you guys have to do for lab today?